I'd like to begin by sharing a bit of background about CGI and our partnership with AVPA. I also recognize already that I'm going to be using a few acronyms around here, so I do apologize. We always love an acronym. The lovely AVPA, CGI will be here, and CMHI, the Coalition for Mental Health Investments. So I apologize for that. But okay, in 2005, President Bill Clinton launched CGI to turn good ideas into tangible action by creating a space where leaders across sectors could publicly commit to addressing some of the world's most pressing challenges. Each September at our annual meeting in New York, CGI brings together what we call our community of doers who commit to taking specific, practical, and measurable actions through our commitment to action framework. At the 2025 annual meeting, AVPA announced a commitment to action to launch a 100 million mental health fund as part of the Coalition for Mental Health Investment, or CMHI. The fund will leverage 20 million in catalytic capital to unlock 80 million in private investment over the next 10 years, helping make it safer and more attractive for investors to support mental health solutions. The goal is to strengthen mental health ecosystems across Africa by expanding access to care, reducing economic and health burdens, and advancing sustainable policy and funding practices. I often say that AVPA plays two roles within the Coalition for Mental Health Investment, CMHI. They are both a core organizing partner and a commitment maker, with their commitment forming part of CMHI's portfolio. And in case, if you do not know, CMHI works to connect, inspire, de-risk, and integrate mental health investment globally. Through this commitment, AVPA will advance CMHI's de-risk pillar by unlocking new flows of private capital into mental health and paving the way for large-scale, sustainable solutions across Africa and beyond. And with that, I'm very pleased to be joined today by AVPA CEO, Dr. Frank Aswani, and Kieran Lewis, the Strategic Partnerships Lead at Wellcome Trust, who will share a little bit more about the fund, their partnership in this work, and opportunities to support and scale these efforts. And Frank, if it's okay with you, I'm going to start this moderated discussion with a question to you. And really, can you speak a little bit more about the challenge and the issue that your commitment is addressing, and specifically how it affects health equity?
Thanks, Christy. And most importantly, thank you everyone who's made time to join us today. We are really delighted that you could make time to be with us. Excuse me, I've got a bit of an irritated throat, the results of flying too many hours around the world, preaching mental health. But I'm really delighted that you guys could join us today. Christy, you asked a really good question, and this is fundamentally important for us at AVPA. We're big believers in falling in love with the problem, not so much a solution, because then you also make sure whatever you scale is the best solution, not necessarily yours, but you hope that yours is as good as the need would require. But we're big believers in falling in love with the problem. So I think that's a really good starting point to start off by understanding what are we trying to solve for in this case. So I'm going to break down my response to you, Christine, into 3 or 4 big headlines. The first one is a financing challenge. And I'm starting this one deliberately because it's in our faces at the moment. You've all seen the massive aid cuts that have hit the developing world. We've seen huge aid cuts from the US government and many European governments. And sadly, the 2 most affected sectors are healthcare and education. So we have less money. We have governments that are very tightly constrained in terms of fiscal spaces and bandwidth to do more. And then we're adding 1 million people a month to the continent. So less money for more people. Over and above that, we've got a very young population. So our average age in Africa is 19. If you compare to the West, which is all above 45 years of age, we're a very young population. So the big challenge we're dealing with now is how do we do more with less? And how do we also take lessons from the past and prepare Africa for such shocks or events in future, so we're not caught with our pants down all the time. We've been through enough of these in the last couple of years, from COVID and now this. So part of those of us, you who were with us at our conference last year, you would have seen how our theme was about future-proofing Africa and how do we prepare for that. So with that in mind, where do we get the money to fund our healthcare investment gaps? And the only place where we can get that kind of money is in the private sector, private capital. So a lot about what we're going to be talking about today is how do we get more private capital into this impact space. But the financing challenge is massive. It's massive in healthcare, and as you can imagine, it's then even bigger in mental health. And then the second thing, a big topic I want to discuss the challenges under is just ecosystem challenges. So in Africa, it's a pretty unique continent in many ways. So for example, we're dealing a lot with cultural stigma. Like any other place, mental health is viewed very, very differently, and purely there's a lot of misunderstanding around mental health as well. I don't know if some of you know this, but in many African languages, in fact, I don't think there's one African language I know, for example, that has a word for depression. Words like that don't exist in African languages. So this is a new phase of trying to recalibrate what this means in managing mental health on the continent. Under ecosystem challenges, there's also a broad underappreciation of the spectrum of mental health. Many people think about mental health purely, mental wellness just purely about treating mental illness, but no one looks at it from the life cycle of a human being, from what is needed at ECD for a young child, to adolescent needs, adulthood, to old age, to corporate employment wellness programs, for example. And most importantly for us right now is how do we maximize Africa's brain economy? We, as I mentioned, we're the youngest continent, and by 2040, 1 in 4 workers globally will be African. By 2100, 1 in 2. So the future of the global workforce is African. So how do we maximize the contribution that young people could make, not just to Africa's growth and long-term sustainability, but also to the global workforce? As the West ages, for example, the West will require healthcare workers, tech workers, all of that kind of stuff. There's very high chance most of those will be African. So that investment in the brain economy is super, super important to drive our GDP and economic growth for the short and long term. There's also the underestimation of the opportunity cost of doing nothing. So what if we don't do anything in addressing some of these mental health issues? What will it mean to our young people, to youth unemployment, to dealing with old age diseases, for example, as our life expectancy grows, to investing in young kids to make sure that we maximize their full potential? That opportunity cost is another thing that people don't look at so much. And then on the side of trying to mobilize capital, there's very few healthcare investors, let alone mental health investors on the continent. So we need to see how we grow that pool of people who are investing in these spaces. And then importantly, you should, as you ask yourself, what's unique about Africa? What does Africa bring to this space that's very unique? One of the biggest things that Africa brings to this space is Africa is a really good place as a global sandbox for testing innovation. And for various reasons. One, we offer a diverse set of challenges. So if you can solve for how you deliver mental health services to a woman in the midst of rural Africa, you can use the same solution to anyone else globally. And the joys about Africa generally, innovation precedes regulation. So when you're coming to innovate in Africa, you have less barriers to drive your innovation to a proof of concept stage compared to many other places in the world. So there's a lot of benefits in that space. And then also, because mental health is also becoming an increasingly young people discussion, we have a lot of opportunities and a lot of young people who are very tech savvy, who can connect with innovators through technology platforms and so on and so forth. So it places Africa at a really good place as a potential destination for innovation around mental health and health broadly. And then the last section I want to discuss this challenges around is around the sector-specific issues. So healthcare in Africa is largely underfunded, mental health even more so. Less than 1% of healthcare budgets go to mental health. We have a challenge with skilled workforce. So we only have 1.4 mental health workers per 100,000 population compared to the global average of 9 per 100,000. We have an underutilization of technology. Despite having potentially the world's biggest tech-savvy customer base, our young people are extremely tech-savvy. If you look across the continent, smartphones are growing. The use of technology across tech platforms by young Africans is massive. I was talking to someone who I met at a conference in the US, and they told me without any marketing, 15% of their customer base, and they offer mental wellness program online, are African. And they've done zero marketing in Africa. But that just tells you that young Africans are seeking solutions in the process. And then two more things around sector-specific challenges. Is generally healthcare is not seen as an investment opportunity. It's seen as a public good sector, and that has to change. Yet in Africa, healthcare has actually a much bigger investment opportunity than agriculture, and many people don't know that. Okay, so we're also selling the opportunities in healthcare as an investment destination, not just as a space that can only take grants and aid and government funding. And then lastly, like many other sectors in Africa, we're also dealing with a very small pipeline of mental health solutions that are commercially viable. And even the few that are there, many are not investor ready. So we've also got to see how do we make these investable, so when we put them in front of our investors, they can attract capital. So those are some of the things we're grappling with, Christy.
Yes, and very complex challenges that you're facing. But I really enjoyed your framing about how you fall in love with a problem over at AVPA. And thank you for kind of painting a picture as well of the funding challenges, the ecosystem challenges, the stigma that exists, and the sector-specific challenges as well. But this is a great time frame. If you can tell us a little bit more exactly the fund itself and how is it going to address those challenges, that would be great.
Thanks, Christy. So first of all, before I go into the fund, I really want to give a shout out to my CMHI partners. So if you're in the room, please just send a wave emoji. CGI, Christy, Frankie, and the team, thank you so much. Kokoro, McKinsey Health Institute, Wellcome. We're really grateful for the support and work you've done. Thank you for the snaps. Yes, thank you, everyone. I really appreciate the partnership we're building. So this fund was launched in September last year at the CGI conference in New York, and then to the African audience, which is kind of a big homecoming, was in November at our conference in Nairobi. So we've kind of been running for a fairly short runway since then. And as you can imagine, in December and January, Africa shuts down because of Christmas break. So we've really got back into it now since the end of January, beginning of February. So we've been doing a lot of work about socializing the fund and socializing and addressing some of the issues I've just raised, that trying to discuss about the spectrum of mental health investment. What it involves is not just about drugs and treating mental health, but also investing in Africa's future through the brain economy. And it's been amazing how people never think of mental health from that context and mental wellness. Yet we do the same. We think very different when we talk about general wellness. We think about keeping people healthy, but there's good momentum. Like a lot of African corporates, for example, have now wellness programs. In fact, almost every single corporate worth its salt on the continent now has a mental health hotline, because a lot of the people who are working there now, young people, Gen Zs, and their mental health is very important, and it's becoming a necessary thing for corporates to offer that. So the fund is doing a lot of socialization around that. We're at the same time educating and trying to normalize and not stigmatize mental health conversations. We are introducing discussion around the brain economy. We are talking to potential funders and contributors to the mental health fund. So there's a pool of funders that we're talking to at the moment. Amongst them, we're talking to governments as well to see, because in the process of discussing catalytic capital, if you can convince your governments in any country to come in as catalytic investors, it could be your biggest win, because they're the largest holders of grants in any country. So that's part of the conversation, but also selling to them, to all these people we're talking to, why it's important for us to invest in these spaces, why, what is the opportunity cost of not investing. We're also, and this is a very important part of our plan, talking to domestic private investors. Part of our big initiative is not just to raise private capital internationally, but can we unlock domestic private capital? Okay, we want Africa to be able to fund itself before we can bring in dollars, pounds, and euros. So it's so important that as part of this theme, we're trying to educate. I'm in Nairobi at the moment. I've spent time talking just to pension funds. And one of the reasons why this is of interest to pension funds is because the youth unemployment problem is a threat to the long-term sustainability of pension funds. If it continues at its current rate, many pension funds in Africa will close in 15 years to 20 years. So they have huge interest in this brain economy space. How can we maximize the productivity of young people? How can we get them to jobs? How can we equip them with 21st century skills right now of critical thinking, problem solving, analytical skills? So we set them up for success. And that way they can become members and contribute to pension funds. So, for example, so it's funny how when you approach this from a problem perspective and not a solution perspective, you get very unusual partners to come to along this journey with you. And that's been a big lesson for us. We're also, in supporting the fund, we're doing a lot of communication and leveraging AVPA's other platforms. So we are showcasing what we can do with pipeline that's coming in, the mental health pipeline. We've done some really successful investor readiness program. We'd like to do the same for pipeline coming into this space. For those of you who don't know, we also have a really cool deal share platform where we showcase investable pipeline to make it easier for investors to access investable deals. We have a deal share platform, so we showcase what's available and investable, how much they're looking for, which countries they're operating in, all of those kind of things. We also have learned through this process that to build a catalytic fund also means you need to have a critical mass of people who understand catalytic investment. And that was another gap. So we had to design a catalytic capital training program to train especially all these philanthropists, aid agencies, governments who are looking to do more with less in this space, to better understand this space and see how they can magnify their impact by doing more with less. And so there's a training program we've designed in catalytic capital in impact measurement, because it's very important that through this, we also measure the impact we're having and how much is each dollar delivering. And then we've got another program that's a broader impact investing fellowship program. So that kind of stuff, providing data, is a big part of what this fund will be able to support. And then, we've also set up a governance structure. So we have an investment committee, we've got a board, and then we'll be building out just the thematic advisory council to support this. So that's a lot of the stuff that we've been looking we've done so far. And we're also very grateful to Wellcome for being one of our early investors in getting us going with this fund. So very, very grateful for that.
That's great. And actually, that's a perfect segue, Frank. Thank you. And to Kieran, don't want to have you just sitting there. Can you please explain a little bit more about how you're partnering on this commitment, how Wellcome's partnering on this commitment, and why AVPA, why are they a partner of choice?
Yeah, definitely. I think the thing I was noting down then, it happened quite a few times last year, is that I need to make sure I don't speak after Frank again, because it's always a little bit terrifying to come straight after he's just given such a comprehensive overview. So I think he's, covered the vast majority of it. I think just for, the background, and I'm sure, most of you have kind of come across some of the work that Wellcome has done in the past. So this year is the 90th anniversary of Wellcome as a whole. We work across discovery science and then three solutions areas, one of which is mental health. And I think for a long time and for the foreseeable future, one of our priority geographies will be across the African continent. I think ultimately the main starting point for us is that all of our core staff are based either in the UK or in Germany. So if we want to do any work around mental health across Africa, then fundamentally it needs to be done in partnership with others. But if you look previously, most of our partners for this work were kind of quite health sector partners. So for the last 20 years or so, we've been working with WHO Afro. We have a partnership at the moment with Africa CDC, which is all about mental health policy making. We've been doing lots of work with Science for Africa with AMREF. But I think what was missing from that is that real kind of expertise around other sectors. So other types of venture philanthropy, other types of private capital, and particularly this kind of way to build more kind of diverse blended approaches to funding this work. So over the last 2 years, we've built this relationship between the Wellcome team and the AVPA team, both as part of the Coalition for Mental Health Investment, but also as a kind of direct relationship. And I think it's just been, transformational for the work that we do at Wellcome. And the expertise, from Frank, from Nasri, from Shadrach and the team has just helped to really inform our broader strategy and, kind of challenge some of our, kind of status quo things that we think we know this, we think we know that. And there is obviously that tendency amongst big funders to think just because we have lots of money, we also have all the ideas and all the answers, which is, I'm sure for everyone who's worked in philanthropy long enough knows that's definitely not the case. So I think, Frank's really covered it for us, which is the scale of the challenge but also the scale of the opportunity around mental health across Africa means that it can't just be relying on the old system. And obviously, the last year has been a totally crazy year in terms of the turbulence within global health and aid. And I think this kind of expectation that, the current thing will end and we'll just go back in time to how things were previously is very naive. So we just need to think really imaginatively and expansively around how we can work. So I think the key, the main reason that we partnered with the AVPA team on this is that it really needs a very kind of open approach to all the different types of money that we can bring into this topic. And I think exactly as what Frank was saying there, how do we start to make, particularly on the youth mental health, how do we start to make the kind of case to all sorts of different audiences? So not trying to pitch to aid funders or Global North philanthropy, but really trying to talk on the continent to all sorts of, private finance, venture capital. I think there's a huge role for engaging the development banks around some of the work on catalytic funding. And I think just the last thing to mention around some of the engagement that we've been doing between the Wellcome and AVPA team. Last year, we were at the Behavioral Health Tech Conference in the US, and the incredible work that Salome and the team have been doing with that event. And I think, the US is a completely different context, but as part of that event, we got to speak to, the team at One Mind in California. We spoke to the Ontario Brain Institute in Canada. There's the work that the Bioinnovation Institute is doing in Denmark. So there's all of these kind of global north examples, but I think there's a real need to build something that's actually on the continent and led by actors across Africa. So I think if we want this work to scale, if we want, as Frank was saying, mental health to be seen as a real investable sector, it can't be about taking models from other countries and trying to bring them to the continent, or, a global north funder saying, oh, we think we're going to take our program from this country and drop it into this country. It has to be about the local expertise that AVPA staff and partners have, and really trying to build something that's specific to the context. So yeah, it's been great working with them, as they develop this fund. And I think it's something where what we need is a really kind of diverse range of partners to get involved. So, for anyone on the call who has ideas, suggestions of who we could talk to, who we could be engaging, I think we need to kind of challenge ourselves to not just keep speaking to the same people we've always spoken to. So, Frank's point on pension funds, there's just sometimes when you're in, these aid conversations and you hear about it being times of austerity, like there is still lots of money out there. And I think we just need to frame this mental health in Africa as a slightly different kind of angle, and just move away from the kind of old-fashioned system of everything being reliant on Global North philanthropy, that, they're not always the most reliable actors at the best of times. So yeah, I think the experience of working with AVPA is, both on this fund, but also for Wellcome's wider strategy, has been, really transformational. And I think just the last plug is a number of the Wellcome team went to their conference last year. And I think for the conference this year, these are the kind of spaces that are needed, where it isn't a group of, non-African philanthropies sorting out an event somewhere on the continent. It's actually led and driven by the team. So I think there's a need for what we see happening so much in the US and in Europe. How can, a group of funders come together to support that work to really take shape in Africa? But yeah, the main lesson is the next time we do a panel, I'll speak first and then Frank can speak after, so that we end on a high.
Don't sell yourself short, Kieran. That was great. That was really, really fantastic. And really, really just echo what you're saying about how we need a diverse range of partners to be at the table. Absolutely. If anything, these past few years have really, really brought that home, with everything that's going on with the global aid situation. And yeah, so this has just been a really, really fantastic conversation so far. And it really leads well into Frank, my last question for you. So yeah, don't worry. Frank follows you, Kieran. Don't worry about it. Frank, how can others join the fund, and what kind of support do you need to scale?
Yeah. So thank you, Kieran, for your comments. And once again, I really want to say thank you to Wellcome for taking a leap of faith with us on this one. When we started selling this to people. Everyone kind of was wondering, okay, so why the unusual thing of mental health? But I'm glad you believed in the fact that we think this is a really important part of growing the continent. As I said, about 60% of Africa is under 60-70% in some countries is under 26 years of age. This continent needs young people supported and invested in if we're going to grow. And it's not just for the good of the continent, it's for the good of the world that we invest in young people. And a big chunk of that is mental health. I'm a parent to 2 teenagers, and amongst my kids' friends, unlike my age group, they're all very open about their mental health. About a third of them are seeing a therapist for various things, not because they're unwell, but just because of support they're getting. It's a very different landscape to the one I grew up in. So this is a really opportune time for us to be looking at supporting these young people through their journey so they can fulfill their potential, but most importantly, really elevate this continent to a different level. So in terms of the fund, how you can support it, so there's 2 big buckets. One, from a financial perspective, AVPA is a nonprofit, so we are always looking for support to fund the program costs. So anyone who can help us with grants to support us operationally, we'll be very welcoming to that. Then the second need to fund the catalytic fund itself. And this is a really good opportunity for you to come and learn with other people, because we're going to pull the capital, a small amount of capital from different people into one catalytic fund. We'll use that money to test different innovative financing instruments, to see what kind of evidence and track record we can build. And then with that, we can then come back and put more money with confidence, because we'll know that this instrument works in these circumstances, so on and so forth. So come and work with us in that context. And the other thing that's very important is for the catalytic fund, we're trying to encourage Africans to come into the fund, because the sustainability and scalability of this fund in the long term, we want to be driven by African capital. So this is a chance for Africans to come and learn from those who've done it before, understand how pool funds work, how catalytic capital works. That coupled with the training we'll give them and the other platform support we'll give them, will put them in a position where they can set up their own catalytic funds in future. So this is in itself, the model is catalytic. The third way is we need some technical support to support things like investor readiness programs. A lot of the pipeline we get is not necessarily investable yet, so they need some support, and that costs a bit of money. And then the fourth thing under financial support is with all the trainings we're doing, sometimes we need some scholarship funding for people to attend these training programs, especially like when you're funding people like government officials who are working in the mental health space. Governments don't always have budgets for things like this, but they're very important in supporting the creation of the enabling space, but also potentially in themselves becoming catalytic investors in future. And then also scholarships for people like some social entrepreneurs who are setting up enterprises in this space. I think it's important if anyone can support us in that direction. And then the second bucket is the non-financial side. This is where we really appreciate if you could share what you're trying to do and what you learned today with your network. Where we'd also be really appreciative if you've got competencies that you think can support our work. Some of you have experience in designing programs. You've got software that can improve efficiencies. You have experience in designing various initiatives, whether it's IMM, impact measurement, M&E, anything that you think you can give us to make our lives better, easier, cheaper, deliver impact quicker, that would be really, really welcome. So, they say you can give back in 3 T's: treasure, time, or talent. All of that is extremely welcome. Share the fund information with your network. We're going to share with you after this a slide deck. So please do share that. Most importantly, come back to us if you've got any questions. If you've got anything you need us to clarify after this call, after you get the deck, we're happy to set up one-on-one time with everyone to do that. And then just connect us with your relevant people. And then lastly, if you've got any innovation that you kind of want to think about testing it in a wide and different audience, please think about testing it on the continent. As I've said, we're a perfect sandbox for testing mental health innovation. So please, there are many ways you can connect with us.
Thank you so much, Frank. And of course, thank you, Kieran, as well for, your time and your expertise here during this discussion. Is really, really interesting. And of course, just like echoing what Frank said, always very happy to kind of help facilitate conversations. And after this call, we will share more information from AVPA, and always very happy to continue the conversation even after this call. But mindful of time, I just want to thank you, Kieran and Frank, for sharing more about the fund, the partnership, and what's needed.